Why parvovirus is so expensive of treating in pets. This video covers various aspects contributing to the high costs of treating parvovirus in pets, providing insight into the challenges faced by pet owners and veterinary professionals alike. Treating parvovirus in pets can indeed be expensive due to various factors including the severity of the illness, the necessary medical interventions, and the costs associated with preventing the spread of the virus. Here's an in-depth exploration of why treating pet parvovirus is often costly. Parvovirus, a highly contagious and potentially deadly illness, poses a significant threat to the health and well-being of dogs, particularly puppies. The cost of treating this virus can be staggering for pet owners, often leading to financial strain and difficult decisions. In this article, we delve into the reasons why treating pet parvovirus is so expensive and explore the various factors contributing to the high costs. 1. Severity of the illness ***. Parvovirus is notorious for its severity, especially in young and unvaccinated dogs. The virus attacks rapidly dividing cells in the body, particularly those in the intestinal lining and bone marrow, leading to severe gastrointestinal distress and suppression of the immune system. The severity of the illness often requires intensive medical intervention, including hospitalization, intravenous fluids, and medications to control vomiting and diarrhea. 2. Hospitalization and intensive care. One of the primary reasons for the high cost of treating parvovirus is the need for hospitalization and intensive care. Affected dogs often require round-the-clock monitoring by veterinary professionals to manage their symptoms and prevent complications. Hospitalization expenses can quickly accumulate, covering the cost of medical supplies, specialized equipment, and skilled veterinary care. 3. Intravenous fluid therapy. Dehydration is a significant concern in dogs with parvovirus due to severe vomiting and diarrhea. Intravenous fluid therapy is essential to maintain hydration and electrolyte balance in affected animals. The administration of fluids requires specialized equipment and trained staff, contributing to the overall cost of treatment. 4. Medications and supportive care. In addition to intravenous fluids, dogs with parvovirus may require various medications and supportive care to alleviate symptoms and support their immune response. These may include antibiotics to prevent secondary bacterial infections, antiemetics to control vomiting, and analgesics to manage pain and discomfort. The cost of these medications can add up, particularly if prolonged treatment is necessary. 5. Diagnostic testing. Accurate diagnosis is crucial for effective treatment of parvovirus. Veterinary clinics often perform diagnostic tests such as fecal exams and blood tests to confirm the presence of the virus and assess the severity of the infection. These tests incur additional costs for pet owners, contributing to the overall expense of treatment. 6. Isolation and containment measures. Parvovirus is highly contagious and can spread rapidly among susceptible dogs. Veterinary clinics must implement strict isolation and containment measures to prevent the transmission of the virus to other patients. This may involve dedicated isolation wards, specialized cleaning protocols, and protective equipment for staff. The implementation of these measures incurs additional expenses, which are ultimately passed on to pet owners. 7. Follow-up care and monitoring. Recovery from parvovirus can be a long and challenging process, requiring ongoing veterinary care and monitoring. Follow-up appointments, rechecks, and additional diagnostic testing may be necessary to ensure that the dog is responding well to treatment and recovering appropriately. The cost of follow-up care adds to the overall financial burden faced by pet owners. 8. Vaccination and prevention. Prevention is often more cost-effective than treatment when it comes to parvovirus. Vaccination is the most effective way to protect dogs from contracting the virus. However, the initial cost of vaccination and booster shots can deter some pet owners, leading to increased risks of infection. Additionally, some dogs may not receive adequate vaccination due to factors such as improper administration or incomplete vaccination schedules, leaving them vulnerable to the virus. 9. Complications and secondary infections. Parvovirus weakens the immune system, making affected dogs more susceptible to secondary infections and complications. These can include pneumonia, sepsis, and gastrointestinal perforation, which may require additional medical intervention and increase the overall cost of treatment. Complications can prolong hospitalization and recovery time, further exacerbating the financial burden on pet owners. 10. Geographic variations in treatment costs. The cost of treating parvovirus can vary significantly depending on geographic location and access to veterinary care. In urban areas with high demand for veterinary services, treatment costs may be higher due to increased overhead expenses and competition among clinics. Conversely, in rural areas with limited access to veterinary care, pet owners may face challenges in accessing timely and affordable treatment for their animals. 11. Emotional toll on pet owners. Beyond the financial implications, treating parvovirus can also take a significant emotional toll on pet owners. Watching their beloved companion suffer from a life-threatening illness can be distressing and emotionally draining. The uncertainty of the outcome and the need to make difficult decisions about treatment options can further compound the stress and anxiety experienced by pet owners during this challenging time. 12. Impact on veterinary practices. For veterinary clinics, treating parvovirus cases can pose logistical challenges and strain resources. The need for dedicated isolation facilities, additional staff training, and stringent infection control measures can disrupt normal clinic operations and impact the delivery of care to other patients. Veterinary practices may also face financial risks associated with treating parvovirus cases, including unpaid bills and potential liabilities. 13. Economic factors and market dynamics. The costs associated with treating parvovirus in pets are also influenced by economic factors and market dynamics within the veterinary industry. Veterinary practices must cover overhead expenses such as facility maintenance, staff salaries, and medical supplies, which are factored into the cost of treatment. Additionally, market forces such as supply and demand dynamics, competition among veterinary clinics, and regional variations in pricing can impact the affordability of veterinary services for pet owners. 14. Specialized equipment and facilities. Effective treatment of parvovirus often requires access to specialized equipment and facilities, which can contribute to the overall cost of care. Veterinary clinics may need to invest in equipment such as intravenous pumps, fluid warmers, and oxygen therapy units to provide optimal medical support for affected animals. Maintaining and upgrading these facilities incurs ongoing expenses that are reflected in the cost of treatment for parvovirus. 15. Research and development. Advancements in veterinary medicine and research play a crucial role in improving treatment outcomes for parvovirus and other infectious diseases. Veterinary pharmaceutical companies invest significant resources in research and development to develop vaccines, diagnostic tests, and therapeutic agents to combat these diseases. The costs associated with research and development, as well as regulatory approval processes, are passed on to consumers through the pricing of veterinary products and services. Treating parvovirus in pets is a costly endeavor, requiring intensive medical intervention, specialized care, and stringent infection control measures. The severity of the illness, coupled with the need for hospitalization, diagnostic testing, and supportive care, contributes to the high costs associated with treatment. While the financial burden can be significant for pet owners, timely and comprehensive treatment is essential to improve the chances of survival and promote the health and well-being of affected animals.